how not all LPR is caused by pepsin. And
Mhm.
I'd love to hear you talk a little bit more about that, how
Sure.
pepsin mediated, but also not.
So the last couple of years, I've really started when I talk to patients and things like that, starting using the term laryngopharyngeal reflux disease, like adding that D at the end, because the actual LPR means the movement of reflux, but the disease or the disorder means all the symptom manifestations. And so we know that your throat can respond with all the same symptoms, even if the reflux doesn't touch your throat. Okay, so what that means is you can be having reflux in your esophagus and it never reaches your throat, but your throat feels it. Okay, and that's what we call indirect LPRD. So the disease itself is divided up into the direct tissue damage causing symptoms, and then the indirect manifestation, which is often a vaguely mediated response. Now, there's a lot of discussion in our field of those of us who specialize in LPR about perhaps making this distinction, not putting both under the umbrella term of LPRD, and that may be happening in the future, but for now, we consider both of them under the same umbrella term.
Can you talk a little bit more about vaguely mediated symptoms and what that means?
Yeah, so remember the vagus nerve has branches in your esophagus as well as your throat. And these branches have some motor, meaning they work on muscle, and also some sensory, so they're meant to feel things. So when there is reflux that's occurring, a lot of times you feel burning without tissue damage because the nerves are feeling that refluxate. Okay. The larynx, which is the organ of the throat, is incredibly sensitive. It's way more sensitive than your esophagus. So it takes less stimulation or inflammation to feel something in the throat than it would in your esophagus. And that's purely from a protective mechanism. Your larynx or your voice box is physiologically a sensory organ to protect your lungs. So it's supposed to be on high alert all the time. So it has branches from the vagus nerve, which are meant to be feeling things all the time. And so when we say vaguely mediated, what we're referring to essentially is that you may be having reflux, which means movement. And it's also important to understand that all humans normally have things that come out of their stomach. So you might be having normal reflux. It's not damaging your tissue or causing ulcers or anything like that. But those nerves are sensing that movement and it's sending you that danger signal. So that's what we kind of mean by vaguely mediated symptoms or LPR.
And how would vagal mediated symptoms differ in terms of treatment from maybe like pepsin mediated, or if there's visible irritation in the throat?
Yeah, so generally for all types, we talk about reducing the number and the amount of reflux, right? So that's kind of the same. I would say the big difference here, if we primarily think this is a vaguely mediated, there's a variety of things we can do. So one is the use of what are called neuromodulators, and this is very classically used in the world of GI. They'll use medications like dacipramine, amitriptyline, which work on nerve endings to reduce sensitivity. Because I specialize, I'm a laryngologist, so I primarily treat when the sensitivity affects the throat. I use a lot of what's called speech therapy for kind of muscle retraining. We do this for chronic cough, call it cough suppressive therapy, irritable larynx syndrome. I will do nerve blocks of the throat for patients who are having persistent symptoms, whether that is pain or globus sensation or irritation, where we inject medicine near the voice box to help reduce its sensitivity. And then also lifestyle, right? So what I essentially am getting at that is if there is some associated stress or anxiety, that will make the system rev up in general. So it's not to say that your feeling is just your stress. There are studies that have documented that being under stress actually makes more reflux, but also sensitizes you to the reflux that's happening. And that's part of its fight or flight response. it just thinks it's protecting you. And so if there is a component of that, we try to encourage patients to get support, either therapy, medication. I've talked to patients about goat yoga, if that makes them relaxed. Sensory deprivation tanks, that would make me feel super anxious, but some people love that. Taking time, there's a variety of ways, but we try to address that component as well.
Thank you so much for speaking about that. I think it's really important people know that this is a diagnosis. And if, all your testing is normal and you're having a ton of symptoms, this is really something to look into. And that's why we talk about so much on this podcast and on the Flora app, stress management, meditation, breathing, yoga. I think it's a core component.